Howdy, cadre, and welcome newcomers. This is irrelevant, symbolic. Don't worry about that. Um, Trigger warnings. This video deals with mental disorders, possibly dermatological issues, trichotillomania specifically, self-diagnosis. I'm going to be getting a little bit personal, perhaps. Trichotillomania. Reading from mayoclinic.org, which I will be criticizing some. Trichotillomania. Mayo wants me to stress the May in trichotillomania for pronunciation. Also called hair pulling disorder, is a mental disorder that involves recurrent, irresistible urges to pull out hair from your scalp, eyebrows, or other areas of your body, despite trying to stop. Hair pulling from the scalp often leaves patchy bald spots, which causes significant distress and can interfere with social or work functioning. People with trichotillomania may go to great lengths to disguise the loss of hair. For some people, trichotillomania may be mild and generally manageable. For others, the compulsive urge to pull hair is overwhelming. Some treatment options have helped many people reduce their hair pulling or stop entirely. Okay, before we continue, I don't think I have this. I don't think I have this mania. And maybe it's a form of hypochondria. I don't know if there's a type of mental hypochondria. Even setting aside imposter syndrome, Dunning-Kruger effect, Cassandra complex, there are several things that I wonder if I have potentially aspects of OCD, bipolar. I don't want to continue that list. In America, we have a serious issue with mental health. We have a serious with the way we handle mental health issues. And this isn't helping. Enough. Let me continue. Symptoms. Signs and symptoms of trichotillomania often include repeatedly pulling your hair out, typically from your scalp, eyebrows, or eyelashes, but sometimes from other body areas, and sites may vary over time. An increasing sense of tension before pulling or when you try to resist pulling. A sense of pleasure or relief after the hair is pulled. Noticeable hair loss, such as shortened hair or thin or bald areas on the scalp or other areas of your body, including sparse or missing eyelashes or eyebrows. Preference for specific types of hair, rituals that accompany hair pulling or patterns of hair pulling, biting, chewing, or eating pulled out hair, playing with pulled out hair or rubbing it across your lips or face, repeatedly trying to stop pulling out your hair or trying to do it less often without success, significant distress or problems at work, school, or in social situations related to pulling out your hair. Many people who have trichotillomania also pick their skin, bite their nails, or chew their lips. Sometimes biting hairs from pets or dolls, pulling hairs from pets or dolls or from materials such as clothes or blankets may be a sign. Most people with trichotillomania pull hair in private and generally try to hide the disorder from others. For people with trichotillomania, hair pulling can be focused or automatic. Some people pull their hair out intentionally to relieve tension or distress. For example, pulling hair out to get relief from the overwhelming urge to pull hair. Some people may develop elaborate rituals for pulling hair, such as finding just the right hair or biting pulled hairs. Or automatic. Some people pull their hair without even realizing they're doing it, such as when they're bored, reading, or watching TV. The same person may do both focused and automatic hair pulling, depending on the situation and mood. Certain positions or rituals may trigger hair pulling, such as resting your head on your hand or brushing your hair. And it would make sense that that this is me adding my own personal thoughts. It would make sense that this order could progress in either direction, from focused to automatic or from automatic to focused. Obviously, if you're doing it long enough, it can become habit, and you can do it without even realizing it. One of my favorite stories about my grandfather, who was a smoker for a long time. One day he went to light a cigarette and noticed that he already had a lit cigarette in his lips. And he got so mad at himself, and he threw his pack that wasn't empty into the trash and said, "I don't even know when I'm doing this anymore." And that supposedly was the last cigarette he had. Anyways, you could also see it starting as automatic, but then building a negative psychology around it could lead to you doing it in a focused manner to deal with the stigma or whatever. Anyways, okay, we're getting through this. Trichotillomania can be related to emotions, negative emotions. For many people with trichotillomania, hair pulling is a way of dealing with negative or uncomfortable feelings such as stress, anxiety, tension, boredom, loneliness, fatigue, or frustration. It can also relate to positive emotions. People with trichotillomania often find that pulling out hair feels satisfying and provides a measure of relief. As a result, they continue to pull their hair to maintain these positive feelings. Trichotillomania is a long-term chronic disorder. Without treatment, symptoms can vary in severity over time. For example, the hormonal changes of menstruation can worsen symptoms in women. For some people, if not treated, symptoms can come and go for weeks, months, or years at a time. Rarely, hair pulling ends within a few years of starting. If you can't stop pulling your hair, or you feel embarrassed or ashamed by your appearance as a result of your hair pulling, talk to your doctor. Trichotillomania is not just a bad habit, it's a mental health disorder, and it's unlikely to get better without treatment. The cause of trichotillomania is unclear, but like many complex disorders, trichotillomania probably results from a combination of genetic and environmental factors. Some factors tend to increase the risk of trichotillomania. Family history, genetics, age often develops before or during the early teens, like 10 to 13. Often a lifelong problem. Infants can be prone to hair pulling, but it's usually mild and goes away. People who have trichotillomania may have other disorders, such as depression, anxiety, or obsessive-compulsive disorder. Severely stressful situations or events may trigger trichotillomania. More women than men are treated for trichotillomania. This may be because women are more likely to seek medical advice. In early childhood, boys and girls appear to be equally affected. Okay. Complications can have a major impact on your life. Emotional distress, shame, humiliation, embarrassment, low self-esteem, depression, anxiety, alcohol or street drug use, problems with social and work functioning, embarrassment, wigs, blah, 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 intimacy and fear, being discovered, skin and hair damage, well, it can cause scarring and other damage, including infections, hairballs, eating your hair, okay, can cause a hairball in your digestive tract, okay, well, all right, so the big reveal, I don't think I have this, I don't think I have trichotillomania. I do pull my hair, and it's I think it's just because of sensitivity and a strong proprioception. Proprioception is a term used for self-awareness. I think it comes from biology, that in the study of animals, proprioception is used to refer to how aware creatures are of their own body. Even that can be tricky because, like, an octopus has multiple brains, so it has a more distributed way of thinking. So from our perspective, their individual tentacles can move and act on their own, separate from the motions of their other legs, and only kind of coordinated by the core brain. But to not get too lost on that, I am using proprioception in a biological way, but I pride myself more on my mental proprioception and emotional and spiritual as well, of course. But one thing that kind of bothers me in this mayoclinic.org listing is there's no mention of dermatological causes. And I've been pulling hair on and off for many years. I don't think in my case, it counts as a disorder, because a lot of these negative symptoms don't apply to me. I don't think it's a compulsion in my case. I truly believe that I'm responding to areas that are areas of skin sensitivity. And to not get into it too much, but if you aggravate the skin, your hair, maybe I should pull up hair follicle diagram just to make sure. So the root of your hair has a bulb. This doesn't help me. I apologize. I should have. Okay, there's a capillary that runs up into the dermal blood vessel. I was trying to see if there was... Well, obviously you have senses in your skin. I don't know how deep they are, and I was hoping to find. Okay, there's a nerve depicted connecting to an oil gland. Okay, there's nerves connecting under the skin to the hair follicle. But not, well, and to sweat glands perhaps, which are separate from the hair follicles. Anyways, my problem usually stems from an area that's aggravated. It gets really bad if I have a zit in the hair, or because I think I can feel that pressure in the neighboring hairs, and I don't know. There's probably deep mental stuff as well, that the skin is the barrier between the world and myself, and I can't get deep into my head right now. So, especially if I have a sensitive area where the skin's been aggravated or something, I tend to try and pull the hairs around it because there's a little bit of relief involved in that. It's usually a sensitivity that is, I only notice when I brush the area. But because of the pandemic, I've obviously been wearing masks, and those push my glasses up against my eyebrows, and so I've been having issues with my eyebrows, and you can see I've got nice donuts for eyebrows because I've been trying to deal with just the consistent rubbing, and then the pain, and it could be amplified by cranial pressure, headaches. I don't know. It could just be oversensitivity. But and this is already resolving well in terms of the skin. That the pain I was feeling is gone, and I'm not getting social effects. I'm not embarrassed by it. I try to hide it, yes, but I spent 4 days with my mom, and it was only the last day she noticed anything was strange. And the thick glasses conceal it somewhat, but because of the pandemic, I'm realizing they're part of the problem. I had a really bad spot here, that got to the point where it was, the skin is kind of broken and scabbing. No bleeding or deep problems, but just, again, annoying. And when I rub the hair, I can feel that sensitivity. There's a hair bulb that, I have done too much reading about this. It really, you can get stuff on the end of the bulb, and from what I've read, if it's white, that's like protein, and it's natural, and it's probably part of the cycle of hair growth. I had no clue before that hair growth goes through cycles which are regulated or managed by hormones, I think. And that may be that may be partly why this is more common in women, is that their monthly cycle of hormone changes may I don't know if it relates to the hair growth cycle, but it could affect that. Certainly, with all the psychology involved, hormones are going to play a factor in that way. But I think physically, there could be some connection to the monthly hormonal cycle, with this hair growth cycle I read about. So I think this white, what is it called? No, thank you, Mayo Clinic. I am not talking about bacterial folliculitis. Um, okay. It's called the root sheath. It's an extension of the epidermal basal layer, which envelops the hair follicle. What is it made out of? I don't know. And this is giving me misleading or conflicting. The bulge serves as a reservoir for hair stem cells. There's a sebaceous gland responsible for hair lubrication. Anyway, the, if there's a dark part on the end of the hair, that could be the hair bulb itself. That is the root of the hair. Repeated pulling can cause, I think, less or more growth. Maybe it's primarily less from what I'm reading now, but certainly it's going to take time to restart the hair and regrow it. But basically what's going on with all hair is you have a bulb that's generating the protein that your hair is, and that continues to be pushed out. Evolutionarily speaking, the hair is useful for warmth, protection. A lot of mammals have thinner skin than we do. Pigs are an exception because, like us, they rely less on hair. But hair can be helpful, like I said, not only for warmth, but protection against cuts and scrapes. We've probably evolved to be a little bit more distant from our environment and more protective of ourselves, but we're also, I don't know. I'm not an evolutionary expert, but what's my point with all this? To get back to the Mayo Clinic, this is focused on a mental disorder, and it says it can be self-diagnosed. on their webpage, but their page does not even mention the possibility of dermatological reasons for pulling hair. By focus on trichotillomania, trichotillomania, and only talking about this as a mental disorder, I think they're potentially causing problems for some people, and they're maybe getting money in the pockets of psychiatrists when a visit to a dermatologist might be a good idea. I don't know what they would tell me. Perhaps, and this is the thing about diagnosis. If this, did I click on this? Is that where I saw self? Okay, yeah, okay. So under the diagnosis section, there is more info. Examining your hair loss, asking questions, discussing your hair loss, and eliminating other possible causes of hair pulling or hair loss through testing determined by your doctor. But yeah, identifying any physical or mental health problems that may be associated with hair pulling. Using the Diagnostic and Statistical Manual of Mental Health Disorders, DSM-5, published by the American Psychiatric Treatment Therapy, Habit Reversal Training, Cognitive Therapy, Acceptance and Commitment Therapy. Oh, accepting your urges without acting on them, okay. Or medications, antidepressants, mood stabilizers, yeah. I don't think this applies to me. So, what I've noticed with myself is there are some times, and maybe I should keep a journal, I don't know, this is going on long. My suspicion is that I am, like I said, a very sensitive individual to certain things, and yeah, I may be preoccupied with the barrier that is my body and how I interface with the world. But it's not, I don't feel like it's a chronic issue with me, because usually there is physical stimulus that I'm responding to. And it's not ongoing. I don't think it pairs up to stress necessarily. It's hard for me to tell because I can experience personal stress and zeitgeist stress in similar ways. And part of my journey has been figuring out when my mood is being influenced by internal thoughts and when it's being influenced by external input, like the news cycle and politics and stuff like that. To some extent, I can control those inputs better, but the internal stuff, I'm left to deal with on my own, and I don't tend to seek out experts when I feel like I can handle it, and maybe that's an aspect of male fragility that I need to deal with. I think I'm doing a lot better than most American males, but yeah, I don't do any of the biting or chewing or the fetishism They didn't mention that, but ritual. Um, I suppose I do both the focused and automatic. The automatic tends to happen when I've noticed when I'm driving. Although that was a lot more pronounced when I was doing more driving, and perhaps after a car accident or two, it may have increased. I know my stress while driving increased after being spun several times across multiple lanes of traffic while traveling at highway speeds trying to get to work. And then later, when I got rear ended in a whole line of cars because the car two behind me was not paying attention. They were both from out of state, anyways. And I know I do it some here at the computer. I'm doing it a little now consciously because I noticed after my shower that my chest was bothering me. It feels tight, but there's specific areas that I feel like I have clogged pores around my hair follicle. And I don't know if that's from increased blood pressure or a buildup of oil residue. Like I said, I just took a shower. And maybe that stimulation triggers it. I don't know what's going on. I am intending to get new glasses. I've just been putting it off between the cost and just scheduling, because I've been busy the last few weekends. Work's gotten busy again, so I don't know when to schedule an eye appointment, which I need before they'll give me new glasses. Because these are 5 or 10 years old, I don't remember. But yeah, I'm gonna get glasses probably that have. Whoops! Hey, careful. I mean, obviously, I need new glasses. I broke these probably half a year ago, and I've just kept wearing them because the plastic holds itself in place enough that I don't knock the lens out very often. I haven't even bothered with glue or tape or anything. And a few people have pointed out that my glasses are broken here, but that is few and far between, and family members, so, or close friends. Anyways, yeah, so I kind of dislike this webpage because it seems very designed to possibly use fear tactics to get you to go into a mental health professional to ask about something that could be a skin condition. And perhaps it's my own problem because I'm looking up this mental disorder, and I should be, but like I said, I've done reading. Hey, there's a name of a psychologist that would be happy if I flew to the Mayo Clinic. He's focused on phobias, anxiety disorders, behavioral therapy. Yeah, I don't think that's for me, buddy. Well, I think I'm gonna let you go. Sorry about my eyebrows. I don't know if that bothers anybody. As more than it bothers me. It doesn't bother me much. I don't like the way I look. I haven't, in this age of self-isolation, I haven't noticed any social interaction effects of it. I don't know. If you came in here off of a search and managed to get through all this, I'd be happy to hear whatever you want to share down in the comments below. Especially if, you're somebody who, like me, doesn't think it's a mental disorder, but think it's caused by physical stimulus. And there's probably some skincare routine I should do. Since I started shaving my face pretty regularly, I've had fewer issues with this, obviously, but fewer zits, fewer. Yeah, I still get them around my ears, especially where my glasses touch my face. And this eyebrow thing only popped up because wearing masks pushes my glasses up more against my eyebrows. So I think there's just a lot more rubbing. There's probably more moisture. Who knows? But I still have this one spot on my chin that keeps threatening to resolve itself. But it's really not too noticeable, especially wearing a mask out in public. But yeah, it's a subdermal thing mainly. Scar tissue. There may be an ingrown hair there that's keeping it an ongoing problem. But that has, I guess, scarred up enough that I'm not feeling that same pressure. That generally bothers me when I'm shaving or when something rubs against it. And yeah, whatever. I don't know. Add some thoughts if you want to. This video is a lot longer than I intended, but I don't expect anybody to watch it anyways, so insert catchphrase here.